So, we're going straight into a question. Staying at the tables you were on before, members, staff, public advisors. Question, and we're going to get you voting on this. How strong is the strength of the strategic? You don't know how many times I've practiced saying that. I nailed it, Caroline. Partnerships, collaborations outlined to ensure contribution to broader economic gain for the region. Get voting, please.
Of course, let's be negative again.
Okay. People online, hope you're still with us in the Zoom room. We'd love to hear from you too.
Fragile.
This is yourselves you're talking about.
Hang on, let's get a mic. Yeah, thanks, Ruth. Sorry to interrupt you. Ruth was eating a cake.
Outrageous. Who put the cake out? So I was wrestling with this in my head, which is why I haven't put anything in Slido yet. But because I think as across healthcare organisations and universities, it's not brilliant yet at the moment, and we're on a journey to try and make it brilliant. So I'm going to put weak down here, and that's not criticising us. That's just saying how well is our health academic health science system functioning at the moment.
I get that. So my strategic thinking around this is that, for example, in the I forget the right terminologies. The economic infrastructure, what do we call it? There's a new term I should remember. But supporting health as wealth and innovation and industry and how we do that. I do not want to create a separate ARC infrastructure that does that. I want ARC to be the glue that pulls together all those different separate elements around the different cities, the different universities, the different NHR infrastructures, and say, put our hand up and say, please come to ARC to help you communicate, share, matchmake, help us, allow us to help you find the right people to lead this project through to success, rather than imposing a whole new infrastructure on it, because that's not going to work, because everyone wants to do it slightly differently.
I agree with that entirely. It would be nuts for us to create something else. We have to leverage from what we have already. But my view is that what we have at the moment is weak, and we are part of the.
But we're going to make it strong because we're the glue.
That's exactly what I was going to say. Yeah. We have to admit we are weak as academic health science systems at the moment, and we need to continue on a journey to make ourselves strong. And we need to be part of that infrastructure as the ARC.
Great. Thanks. Anybody else in the room? Oh, yes.
A little bit like Tony, to be honest. I really wanted another answer to be there. You seemed to go from you're either strong or you're weak. But actually, I think weak's a bit hard. But if, you know, my experience is we're certainly not strong. So we're probably weak.
And there we are, folks. Thank you. Anyone else? Or I can move on. Going, gone. Let's go on to then our second question. Which organisations are missing that we should be collaborating with? So this is free text. Obviously, it's not a vote, so do pop it up there. And Mike over here, please. Por favor. Oh, Darren's running. Ruth, come on, Ruth.
You beat me to it. I'm just going to ask the stupid question. Missing from what? Is there a list that we should be looking at? Where's the list of organisations so I can find out if someone's missing?
It's on the ARC website.
But that's ARC, not ARC 2.
Yeah,
We're
but
starting
we're presuming
okay, well,
we will approach every single...
There's no such thing as a stupid question.
No.
Some examples. Yep, great. We do expect you to know the website inside out. There's a test at the end.
So I hope this isn't Liverpool Health Partners saying that they're missing, because they're not, because I've talked to them about
why is that one in
the last question. ICBR and iLeads have definitely been involved. Some of them are in the room. And the ICBs are definitely members. I think it's maybe that people just don't realise all the different member organisations that we've got.
Sean has popped a list of members in the chat, if that's help. Oh, is that the Zoom
Betsy
chat?
Cadwallader. Is that not in Wales?
Yes, I know that's Professor Williams.
Well, he's here.
again.
He's here.
No, it's Professor Williams put that in because he always does.
Oh, right, okay.
England.
You want to move Betsy Cadwallader to the northwest? Well, Neighbours is fine.
Noisy neighbours.
This is getting rabbly this afternoon, isn't it?
Like City.
Go on then.
No, it's just we should be thinking about neighbours. And some neighbours are very close, even though they're being chiselled off the map.
I mean, joking apart, does anybody know what the current position is of the devolved nations in terms of NIHR? I don't think they can formally be part of ARCS because it's an England initiative. But I thought there was a greater expectation of inclusion of the devolved nations in terms of England, Wales and Scotland in NIHR applications then. So in terms of involving North Wales in our external grant collaborations, absolutely that's something we could be doing and should be doing.
What's the girls' network?
So,
The girls' network?
so if I can just come back at that, Mark, just a bit. Yes, neighbours, but also patients in many of the tertiary care centres in Liverpool are from North Wales.
Yeah.
So it's a bit of both, but it's also thinking about how we can learn from other systems as well.
So there's quite a few, I mean, it's reassuring to see lots of these on here because you don't know, but they have been involved. So if we go to the, as we intend to, the integrated care partnerships, the fire service, the police, etc., and lots of VCFE will be on, voices will be in that, in that relationship. Nurseries, I presume you mean children, not nurseries as in children, not as in plants. Manchester, well, Greater Manchester and ourselves and Yorkshire and Humber and North East and North Cumbria are already talking about, with the Northern Alliance, about how we can do some common work and collaboration. So they are definitely part of the discussions.
And Deirdre on Zoom says, should we include some more national patient organisations?
Like the Stroke Association or something? Sure.
And Diabetes UK, we do that as one of the places we go to, but they usually send us regional people.
Okay, there's a few more people contributing. Anyone in the room want to comment? Anyone online to comment, Sian, other than Deirdre? Yes. Right, thank you, Deirdre. Yes, hello.
Induction.
Yeah, just thinking outside the box, what about the people who are building our 300,000 new homes in the UK? That's quite a wide group of professionals, organisations.
You mean the people that actually do it or the companies that try and make money out of doing it?
Yeah.
Should we have the town planners in there?
Hang on, Darren, thank you.
Sorry, I trained as a planner originally, so I'm
So I would, joking
I don't mean
apart,
planners. I don't mean planners. I mean the actual house builders. Yes, we do engage with registered social landlords. Don't think we engage with private companies, architects, urban designers, etc. as well. We talk about complex systems, but we often don't really look at them. But anyway,
it may emerge from the health determinants research collaborations and the local authority research that they want to focus on the quality of housing, the placing of housing, the impact of housing on health inequalities. And then we would work with those organisations, I think, rather than separately in the connections and links that they're making in their because unless they're engaging with the local authorities in the planning, then I don't see that we can influence it much. But if I'm expecting that might be an emerging group we can discuss it with.
Thank you.
But the environment and green and energy, etc., have all been things that have been mentioned that will become almost certainly larger as the ARC2 goes through, and that will involve building energy efficient houses, which I think we all know is not what's happening at the moment. If you go to Germany, you've got houses that are almost sort of 95% energy efficient. I don't think that's in the building specs in this country still.
Hang on, you've got no mic. I'm just
Anyway,
going to move us on if that's
detail,
okay.
let's move on.
Sarah, thank you for sharing online. Housing developers and town planners as part of the whole system is very important. My friend here at the front, because we're friends now.
Oh, God.
Get up here and say that.
No, just I can't. Just in the little sliver of the screen, I can see I've got third sector, VCFE sector, VCFSE, charities. I just wanted to point out that on the ICS footprints across England, so 42 ICSs, there's 42 voluntary sector alliances. So that is a really good entry point into the voluntary sector, because if you're just trying to engage the entire voluntary sector, just in Lancashire, you're talking nearly 20,000 organisations.
But there's also about, I think, 10 or 12 members of the ARC at the moment who would fit within the charity third sector organisations, at least that many. Yes.
Yeah.
I'm going to go here. Hello.
But it's both, because that's what Corin does.
I wondered if we're engaging with prisons and veterans, so whether those two are...
So it is part of the small print of the priorities of populations, and it didn't come out picked out in the guidance. But yes, there is definitely something about people who have come from prison, and they will be in the getting people back into work. They'll be in those often men who've got particularly poor health, substance misuse, etc. Some of these things are in the core 20+5 that would be potentially things that come through on some of our themes, but yeah, absolutely, they're part of the particularly high-risk populations.
Yeah, and veterans are associated with that because obviously they overlap with the prison population, but also we have the covenant in the region that's actually quite strongly supported by the local council, the Veterans Covenant, so it could be something to think about.
Great. And Paul, thank you online for commenting. If we're not collaborating with the right people groups, are they aware of the ARC and how to reach out?
So, some of these groups have already worked with us. Active Lancashire, the work in Lancaster. Some of these...
No, they're members.
Yeah. Some of these member organisations, some of these identified, are already in the mix.
Great. Okay. Brill. I'm going to move us on, if that's okay. So our next question is to do with priority. So which of the following priorities set out by NIHR feature most strongly in our bid document? And we'd like you to pick your top 3. Should or do? Which?
Do.
Do. Yes. Which feature most strongly in the bid document that are set out by the NIHR? We are assuming you've read the bid document.
Well, not the document, the what was circulated.
Yes, sorry. Oh gosh, I don't know. What's useful? Yeah, that.
I can't use this on the phone. It's a nightmare.
Is it tricky?
Keeps dropping back. It's at the bottom deliberately.
If you scroll down.
And then you have to drag it up.
Yeah.
It's a test of your gaming skills.
Okay, members, while people are still figuring out how to scroll, I'm going to ask you a question, so tune in. Members only, we want to hear from you. There's going to be a general discussion from you, please. Are your organisation's own priorities reflected in what are going to be the top 3 answers? That's what we'd like to hear from you. And I don't totally know where you're sitting, so I'm scanning casually. But if the members could wave at me. Thank you. Thank you, Ruth. Great. So let us know. Do let us know. What are the top 3? Are they the ones in blue?
Yep.
Thank you. Do they reflect your organisation's priorities? Speak now. Speak to me. There's a yes and a no. Ruth, get these. Yeah. And then there. Great.
So I thought that prevention and kind of long-term conditions and multiple morbidity came across really nicely in the bid, but I guess that doesn't completely reflect the priorities of my organisation if I'm from Liverpool Women's Hospital or my part of University of Liverpool.
So the top 3 don't represent your organisation? No.
But if you think of your new organisation, well, UHLG.
Did you want to say something? No. Hang on, we've got to have a mic. Yes, go for it.
Hiya. So I'm from Merseycare. I'd say our top priority is probably mental health. It's not really mentioned explicitly, mental health, in the document, but it's just seen maybe as a underlying perennial sort of idea behind it. And I suppose with dementia as well, it's mentioned, but it's not really expanded on as well in the document as well. That's probably what I'd think.
Okay.
It will be. It definitely will be. In terms of the mental health keeps coming up, and the reason it's not there, we did ask this question a number of times at various meetings with ARCFEST and others, and the same message kept coming through that people felt it shouldn't be boxed off as a separate thing. It should be throughout all of what we do. And so that's why it is done. And the other argument is that MRIC, the Mental Health Research and Innovation, what does the C bit stand for? Centre. I was thinking collaboration, but it's centre. That's already quite a large £10 million programme that's happening in the south part of the patch. And to try and compete with that or dilute those resources into doing a theme in ARC didn't seem likely to be successful, because we could end up with asking the same people to go to different meetings and different groupings rather than saying what's already happening in the space of mental health research, and there's a lot happening, and how do we support it with ARC and spread it with ARC across the whole of the North West Coast region and build on what's already happening rather than doing something that could be seen to be in competition or diluting that. As for dementia, I hope people think that what we've been doing in ARC, it's already a well-known strength. It's just that it's not highlighted in this document.
I'm going to go online, then I'm going to come to you, if that's okay. Sian.
Yeah, can we have David Redman, please?
Good afternoon, everyone. Yes, from Active Lancashire perspective, as an active partnership, our priorities are health, criminal justice, environment, and children and young people, broadly speaking now. The work that you guys do does filter in all of that. But looking at the response in the Slido, you can see you've got number 1, children and young people, major conditions, and multiple long-term health conditions. 1 and 3, the children and young people, multiple long-term health conditions, resonate with us quite well. But I would also stress around prevention. That is a big thing that we are looking at as an organisation, working quite closely with Lancashire and South Cumbria ICB, and also from a local authority perspective as well, especially around devolution. I know that's a separate issue altogether, but we're just keeping our ear on the ground with that. So they do align, but we do have other things as well that we have to consider.
I hesitate to say this in the presence of a number of professors of statistics, but I suspect that the difference between 3 and 5 is probably just very minor variation rather than any significant difference. They're all seen as being pretty closely coming up behind 1 and 2, I'd have thought.
Yes.
Yeah, I think the one that's missing follows on from the Merseycare colleague is mental health, and My worry is if you're not, I think your explanation, though, Mark, that's really helpful. But I think you've got to find some way of making that explicit through the document.
It will be in the document, don't worry.
My worry is once you don't name it, it doesn't look like it is and for anybody to say mental health is not a priority for us, and that's not, I know that's not what you were saying, but if it's not explicit, you can't say it's a priority.
Yeah, I guess that's the difference between priorities and themes. And it's about capturing in the narrative of the themes the importance of mental health. So it's obviously going to be in multiple long-term conditions, and it will be also be in children's health, it'll be in women's health, it'll be in lots of the narratives.
Yes.
And public health, obviously.
I'm not sure how this poll is going to help you in terms of writing up the bid, if it is going to translate, the same as that. But my only concern is that with the recent recommendations of, delivering care closer to home, that doesn't kind of appear at all, and it is 9th on the priority as of now, according to this poll. So that's a bit worrying.
Yeah, it came very last minute, because it wasn't mentioned at all until the guidance came out, and I think we know where it came from. It came from Uncle Wes, but understandably, because it's the new 10-year programme, and that's one of the challenges, I think, for the ARC too, is we're not even going to start till 2026, and we don't know what the 10-year programme is going to be emphasising. So we're being judged on outlining what we're going to do, when I'd be astonished if we're still being asked to do exactly the same things by the time we actually start.
Yes, and then we'll come to you.
I'm just going to highlight stroke, because obviously I can see how it fits under major conditions, but we have one of the biggest, if not the biggest in the country, multidisciplinary stroke research units at UCLan. But it's not specifically mentioned. I can see where the likes of our research fits into different aspects in terms of prevention and multiple major conditions and things like that, but it's not.
Well, in my defence, it was in my version.
All right, okay.
It got edited out because we had to simplify it for today, but cardiovascular absolutely will be involving stroke and stroke risk, and prevention will be a lot of stuff about stroke. We talked about primary, secondary, tertiary prevention, but then we decided that really doesn't work in terms of not everybody in the room will even understand what I'm talking about. So we've not gone down that route in how we describe things, because we don't think it's understandable by the wider population who we want to understand what it is we're doing and why. So there are those challenges in comms of how we describe what we're doing.
Yes.
So there's some really important kind of cross-cutting themes that you've discussed, like mental health clearly comes throughout all of the elements, as does as does women's health. Could be another excellent one to be
a focus across all of our work.
A focus across all of the work. But I think for me the difficult thing in understanding that is the mechanism that might take to ensure it's foregrounded, especially with the explanation you gave at the start about how themes are expensive, because themes is where the kind of funding, how the funding seems to flow. And so then how would those areas be prioritised?
So one way of doing it would be as a prioritising factor. And so in addressing stroke, have you talked about mental health? Have you thought about the impact on people's mental health for both the carers and the people who've suffered the stroke, for example? Or there might be other ways of doing it, but how, is your proposal thinking particularly about picking up what we can see about women as opposed to men who've had a stroke, or whatever it might be? I'm just throwing ideas into the air, and it's maybe a bad example, but I think it's about that. It's about how we as a group look for those, what we know are key elements of those questions which are under-researched and need to be investigated when we're doing something. So are we looking holistically at physical and mental health? Are we thinking about those inclusion factors? Are we making it part of the questions and the data that we're collecting, and what are we going to do with the results, which is what the HIAT's supposed to do? And that was my mad thinking about how, as an organisation, we would pull that together.
And I was imagining that the member priorities would need to be need to articulate how they aligned with the ARC themes and foci, if that's what we're calling them. But the member organisations would be putting those forward. It's not that ARC will be asking for bids around something. That's not the way it works. The members come forward with suggestions of things that they have as priorities, and they want the ARC to work with them on it, really. So the infrastructure of the ARC will be serving the members in a way, working alongside the members on doing something robust around the priority area that they've put forward. That's my understanding of it.
Folks, I've got to move us on. I want you to hold that for the Q&A. We've got to get on to another question. Is that okay? Thank you. Appreciate that. Okay, another question then, again on Slido. In 3 words or less, which specific health-related topics do you feel is still missing from the bid document but reflect a specific need of the North West Coast?
Can I just tweak that slightly?
Yeah.
Bearing in mind that I have in discussions pointed out the words that are missing but are there underneath what you can't actually read. So we talked to a few people like things that aren't actually articulated in words in that diagram, but I hope you realise from the discussions today are there. Such
Gout.
Stroke. Brain health. Well, that's how I described it. That was in there. Rare conditions. Good. We do have that will be particularly in children and young people. We will have a strand of health rare conditions in there. We've got a lead we have a national centre for renal conditions, rare renal conditions in the North West Coast, and that will feature in our narrative.
Yeah, neurodiversity is a good one.
Yeah, I've already spoken to the person who's going to be putting that in.
Mm-hmm. What's field?
Left field. Things have got thrown around. As
oh, right, okay.
Because suppose, I'm not aware as a topic. Or sit.
There's also this comment from Mandy on Zoom. Northern Health Science Alliance, good to see a strong focus on child health, which is one of our key priorities, building on Child of the North. Maybe worth linking to our Northern Child Health Network. Prevention is another key priority and is the focus of work we are developing with the Northern Mayors through our data and AI network. Sorry, it's hard to read. Oh, there it is. Great, you've got it.
And we are in discussions. We've already had those in emails, so we know about these. And
Great.
As the Northern ARCs have been talking about this as well. So
Great.
There is a potential for some cross-ARC working in some of these.
Are there more social care things that are missing?
Carers, I thought, is definitely in the workforce outline, and it's also going to be in the social care outline.
Can you give her the mic, Darren? Thanks.
I was just thinking more of informal carers,
Yes.
I guess.
I know,
And it's whether they would see
asked earlier, so
themselves
they'll
as-
definitely be in the social care inequalities, and they'll be very largely represented in that. But I've also, and I think I may have picked it up wrongly, but I thought the workforce was going to look at the formal and the informal workforce.
Okay. I don't
would
think it comes across like that.
No, it won't do yet because we've not.
Okay.
I've seen documents that you haven't, so we've just tried to summarise it in one slide. But these are really important points for the theme leads and co-leads who are writing the themes to pick up and build in. But we can't be seen to be doing everything. If we're too broad, we can't write it that way. We will inevitably focus down on a few short-term objectives of things that we know we can start. And Tony was talking about this. There's a risk you state one of the challenges of writing the bid, which is then accepted, is that then becomes what we're judged by. And so each year we have to report, so what have you done about X objective? And if we say, well, actually, that was a good idea at the time, but we never did it, you've got to go through a whole rigmarole of saying why you're not doing it now and what you're going to do instead and what you tried to do to get it kick-started and why that didn't work. So it is a contract we're writing with NIHR when we write this proposal. So we can't be all things to all people. So we have to have a core short-term objectives, but demonstrate how the expertise within the theme groupings and across the ARC can flex to meet unforeseen or new emerging priorities that we have the strength and the capability to address. And so that's, I think, the challenge of how we write it.
This flows into, naturally, our Q&A moment. And we'll make sure we come to you if that's okay after.
I think I just jumped the gun a bit.
No, great, we're ready.
I just wonder about positive well-being, you know. I mean, all of this is about pathology and negativity, by and large, apart from a few areas maybe. So I just wonder if we also, and again, I'm not saying it's going to be a theme or anything, but just to bear in mind that actually in many of these areas we're talking about, there's asset-based approaches that can generate positive well-being, and that maybe we should be also thinking about that, which builds into the community-based piece that we've been talking about already. Just not to miss the fact that actually we're about generating positive well-being ultimately, rather than just curing illness and disease.
Great. Yeah. Thank you. Hello, thanks for your patience.
Patience is unusual, I've just been told here. I was going to ask actually about brain health, because it wasn't there in the original, but now it is in that last lot, as is neurodiversity, as is learning disability and autism. Now, if you were to add the three of those up, I imagine I'm hoping we'd have the biggest word on there. Neurodiversity was one of the biggest anyway. But what I was going to ask, I do know, because I've been talking to people at Candid. Candid is the research arm of Cheshire Wirral Partnership and Lancashire Care. And they are keen to work with us on neurodiversity in collaboration with ARC2. And also, of course, we've got sitting over there a man from the Walton Centre, which is probably the best brain health hospital in the whole country. And they also need to be part of that partnership and so on. And I think we've got some fantastic people in this area who could do some amazing things in that area of research.
I didn't know about Candy, but I do think it's a sign of where sometimes we fall over, that because we've got Emmerich, we've got Candy. And so rather than saying how can we work together across the three major mental health trusts, we've now got two mental health trust organisations doing research. I don't know whether ARC can help solve that, and if I've said the wrong thing and out of turn, I'm really sorry. But, you know, I'm retiring soon.
Oh.
Not that soon.
Yeah, we'll go online.
Yeah, so a lot of people are saying about a health creation focus. So not just studying, disease to create.
Yes, it's about health creation, health and well-being. So obviously we will talk about health and well-being. And we do that in a number of ways. We do that by making people's lives better and better managed if they do have an illness, or if they're caring for people with an illness, hence the whole thing about carers and supporting carers in the informal workforce, about supporting families, about wealth creation, about health determinants. So hopefully, although it's not explicit, we will make it so in the bid that this is about prevention and about people living healthier lives. And that, I think, is what we do a lot of now, and will continue to be something we do a lot of. Because within those priorities, we're not going to just talk about how do we treat stroke, it's how do we prevent stroke. How do we help people live better who've had a stroke?
Yes.
Yeah, just on Emmerich, and from what I've seen so far, the research is going to be different to what we've talked about today. I think it's not health inequality focused, it's more pharmacy sort of stuff.
Disease focused.
Yeah, trying to work out symptom profiles and things like that. That's what we've found out so far. But are
Depends which work stream you're in.
Okay. I mean, are they collaborators or are they competitors?
Merseycare, I hope, is a major part of the bid.
Okay. I mean Emmerich rather than Merseycare.
Emmerich is University of Liverpool and Merseycare, therefore they are collaborators. Mental Health Research and Innovation Centre. It's part of the Oxford NHR funded, isn't it, as a parent? Yeah, Mental Health Mission, that's right, which has a lot to do with the Oxford VRC.
Can we get you a mic? Thank you.
Part of the Mental Health Mission, and I would assume part of the University of Liverpool's commitment to ARC, this kind of making connections and that sort of thing.
Absolutely. It's a lot of the same people, to be fair, so it'd be daft if we're saying one thing in one organisation and something else in another, because it doesn't make any sense. If the same person's competing against themselves for what research activity they're going to be doing and supporting. So yes, absolutely it should. But we also want to be really inclusive to the other. And don't forget, most of mental health isn't managed in mental health trusts. It's managed by people like me and Nevin and others and Greg, as well as people in the communities. I'd love to see much more recovery support in communities rather than always thinking about what does NHS do.
Or prevent people getting mental health problems after they've had a physical health problem in the first place.
So Lynn on Zoom says thinking... Oh, it's gone. I lost her.
Climate change.
Where will the new ARC be hosted?
Oh, there's Lynn.
What's it called?
Called
University Hospitals Liverpool Group. And the ICB are supportive of that switch. So it's a number of the big trusts in Liverpool coming together, but with an avowed expectation and drive as a group to support research across the northwest coast, and they see the ARC as one of the mechanisms in hosting the ARC to bring together the research across the wider northwest coast with the collaboration with Liverpool rather than everything sucking into Liverpool. That's absolutely not their intention. But they do have a bigger critical mass to support a large organisation such as ours in terms of governance and all the support services that we need. And the ICB has other things that they're being expected to do by the department. So they are keen to use that opportunity to give up some of those functions as a host to enable them to spend more of the energy that they do have R&I on working with the ARC in delivering and prioritising research rather than governing it and doing the finances for it.
So we've got a couple of questions from Zoom. Thinking more about generating positive well-being being a focus, isn't this something which is it's gone.
Very likely to make the ARC.
No, that was the other. Oh, yes. It's back. To make the Northwest Coast stand out from the crowd.
Yes, but, you know, our focus is to be to implement research into practice. So we need to generate the research that shows how we can build positive well-being amongst our populations and what that's about, which I suspect is things like jobs and education, which I'm not sure we can necessarily deliver.
And there was one from Keith.
You know, it's where we can add value.
Here we go. Appears to go into schools and colleges with support of ARC Northwest Coast, focus on mental health.
Turn it into a deliverable research project, and yes.
Off you go, Keith.
Go, Keith. Any more in the room?
Is that Keith Holt?
Yeah.
He's right, Vince.
Yeah.
Any more in the room? Lynn's coming in thick and fast. It might be worth us linking with occupational health.
So return to work. So that will be, if it's not in workforce, it'll be in public health. But absolutely, it's one of the asks, and that came in the revised guidance because of the drive from government to get, hopefully not by giving everybody Wegovy, but maybe I shouldn't have said that. This isn't being recorded, is it?
Of course it is.
We've got one here that we gathered earlier. Let's challenge conventional ideas. How can we really synergise researchers, public and practitioners?
We're not perfect, but we're doing it a lot better than we ever used to, and I think a lot better than maybe others do. I think we're pretty good at that. I hope that nobody could point to a project in the ARC that doesn't have a reasonably robust co-production at its heart, which is about synergising, I hope, if we're doing it properly. I don't think it's tokenistic, and I know the HIAT's hard, and I know people struggle with it, but that's to stop it being tokenistic. Because you can't do a HIAT and be tokenistic, not if you do it properly. Tony's going to tell me I'm wrong.
Oh, Darren's there.
Yeah, just reflecting on that, I think the challenge is to really have a significant influence on the culture on our patch. So we can have these kind of little small areas where we're having influence, but how do we actually substantially change the culture because it needs changing?
Well,
and that's, I know I'm throwing it out there, and there isn't any
big question.
to that, but that's really what we need to be on a journey to do, isn't it?
I hope we are, but we have to do that. We can't do that. My argument for doing it, which is really painful, what we're doing today, rather than me saying we've been to the ICBs and these are priorities and these are the themes are going to deliver those priorities, is my hope and expectation that we build the member organ and the rest of us, the team, that we build the relationship with the member organisations to take on board what it is we're trying to do and to get involved in that big project and to start to spread it internally. But they will have competing priorities, as we know, from delivering against their targets that keep changing, all the new work that comes in, the waiting lists, the need to bring money in from pharma trials. We are competing in a very busy space, but we have to keep chipping away and making it exciting and interesting and valuable as a group. And we all, I think, have a responsibility as an ARC member to contribute to that and to foster it and to promote it back in our own organisations. I bang on about it in the university until people will say, will he shut up and stop talking about ARC? But I do it because I'm trying to help change the way that academics think about collaboration and co-creation. We bang on about public involvement, we bang on about practitioner involvement, pathway to impact, and I think I've got allies here who are smiling at me but I think they agree with me, that's what we need to do, but we have to keep banging the drum. I can only do what I can do in my organisation to some extent. We all need to do it in our own organisations, in each of our trusts, universities, charities, VCFEs, wherever we are, to say, this is worth doing. If you're going to do something, do this works.
And I wasn't trying to put that on your shoulders, but I think my reflection and frustration is that the bottom-up stuff is piecemeal and is just going to take forever. And unless we've got really significant buy-in from our partner organisations, and that's not just from the top, that's from actually in the middle and on the front ground, so that the clinicians are actually fully engaged and really want to make things changed, we're going to struggle. So that's the culture that we need to...
I'm with you on this, and I'm going to disagree therefore and make myself very unpopular with points. One of the points on this screen in front of me. Priorities should come from those with lived experience and from clinicians, not from HCI if you want translational research. That's true, but it's about the co-creation of the projects that do that. The priorities actually, whether we like it or not, come from the department, because that's where the ICB's priorities come from. And as I've said before, they reflect changes in local priorities to some extent, but that's where our priorities come from. I think the days of being able to go to the public and say, what project would you like to do, and ARC will give you money to do it, are not really where we are now. That we've been told in the guidance not to do that. We do it as creating capacity and collaboration, giving people projects that they really want to do within their priorities, because that's what motivates them to come and do an internship, and building on that. But the bigger projects have to meet the priorities. The solutions come from, that we test or we implement, come from what our knowledge mobilisation, knowledge exchange systems tell us from the patients, the experts by experience, whether they're practitioners or service users or members of the public, working with academics to find the right solutions and then maybe do research into them or implement them. But I don't think we start from nowhere and do bottom up give us lots of little ideas and we'll have a go with them. That is not what we're being asked to do. We might think it's what we should be being asked to do, but it's not what we're being given money to do. Sorry.
But we can make things a burning issue if we do the right things to highlight it. So, I mean, that's the main thing. You can put suggestions into NIHR to get commission calls for particular areas of things. People do that. They write a brief to say this thing is a real issue and we need to do something about it. Yep. And then they will have a team that look at the research that's been done already, what the key messages are, and then will commission calls for that particular thing. And that may be something that comes up for this 75 million.
Yep.
Folks, I've got to draw this bit to a close.